Hastings Prince Edward Public Health works to help the people in our communities achieve and maintain their best possible health. Our 150 staff provide programs that focus on both health promotion and health protection, aiming to keep the public safe, as well as provide information that will help them live a healthy life. This report summarizes our activities for the fiscal year ending December 31st, 2016. Our corporate priorities in 2016 included promoting evidence-informed practices and excellence in service delivery, increasing community engagement and responsiveness, ensuring compliance with legislative and provincial standards, and strengthening organizational capacity. 2016 also saw the introduction of several provincial initiatives that have impacted our work at Public Health. The introduction of Patients First legislation has set the stage for change that will continue over the next few years, resulting in greater integration of health services and increased collaboration with the LHIN and other stakeholders. Work continued to take place to revise the standards for public health programs and services, which will guide the way we deliver services in the coming years. Guiding reports were released on the national opioid crisis, and these were supported by the local development of our own opioid strategy. These changes and more have continued to influence the way we deliver public health programs and services. This report highlights the many ways our team worked to maintain public health in our region in 2016 through the provision of quality service, evidence-informed practice, accountability, equity, partnerships, and collaboration. We provided education and clinical services to support healthy sexuality and provided low-cost birth control, testing for infection and pregnancy, and counseling. We helped individuals prepare for parenthood and provided support to new parents and caregivers of young children. We promoted oral health at a young age by visiting all publicly funded elementary schools to provide dental screening and promotion, and by providing free preventative dental services for children up to 17 years of age. Reproductive health programs and services were offered to individuals and families, helping them prepare for conception, have a healthy pregnancy, and prepare for labor and birth. We provided home visits to vulnerable pregnant women and families with children up to 6 years of age to set goals and coordinate services to help these children achieve their potential. With funding from the Public Health Agency of Canada, we delivered community programs that provide additional support to women and infants. We work to reduce the risk of chronic disease and injury in our area by encouraging healthy behavior and by working with the community to create living environments that support health. Efforts continued to prevent the occurrence of rabies by ensuring all animal biting incidents were investigated within 24 hours and providing post-exposure treatment. We work to keep recreational water facilities safe through inspection and education. Through testing, treatment, and ongoing response, we work to ensure a safe drinking water supply for all residents. Efforts continued to keep drinking water systems safe by ensuring system owners were compliant with legislation and by providing them with support. Through monitoring and by raising public awareness, we worked to prevent the occurrence of vector-borne infectious diseases like West Nile virus and Lyme disease. Through education and inspections, we worked to prevent and control the spread of infections in personal service settings. We help the public prepare for emergencies by giving them the information and tools they need. We investigated and addressed health hazards and raised awareness of these hazards to keep the public safe. We continued to work with community partners to deliver our needle exchange program and distribute safer drug injection supplies, and began work to address the growing opioid crisis. We worked to reduce the risk of communicable disease by monitoring, investigating, and responding to disease trends and cases. We offered immunization clinics to help reduce the occurrence of diseases that can be prevented through vaccine. We enforced tobacco legislation, raised awareness about the hazards of smoking, and offered services to help people quit. We helped ensure food was handled safely in public settings. We continued to establish and participate in collaborative partnerships and coalitions to address public health issues with non-health sector partners. Our team worked to deliver essential public health services in 2016.
This is Public Health.
Go to hpepublichealth.ca 966-5500.